Britta. I'm a student nurse and I'm here to take care of your tracheostomy right now. Can you please verify that the name, date of birth on your wristband is correct? Alright, Miss Elephant, do you have any allergies that I should be aware of? No? I know it can be difficult to communicate with a trach, and so if you want to give me a thumbs up to communicate yes, and a thumbs down to communicate no, and then at any point during this, if you need to take a break because you're having a hard time breathing or you're in pain, just go ahead and raise your hand like this, and we'll take a short break. Does that work for you? Okay, good to hear. As I was saying, a tracheostomy care is going to include 4 things. We're going to suction, we're going to replace your inner cannula, perform peristomal site care, and then change your stabilization collar. We do these things to improve your oxygenation, remove secretions, reduce your chance of skin breakdown or infection, and just make you more comfortable. Do you have any questions so far? No? Okay. So before we begin, I just need to get a quick baseline. Are you in any pain at all? No? Okay. I'm also going to take some vitals. We're going to get your heart rate, your oxygen saturation, your respiratory rate, your respiratory effort, and then lastly, I will listen to your lung sounds. Okay, so now that we have this baseline, I'm just going to make sure that I brought in everything that I'm going to need. So I have a drape for you. I also have PPE for myself. I'm putting on goggles and a face mask right now. I also brought in a size 12 French suction catheter. 10 to 12 is recommended for adults. We have a tracheostomy clean care tray, and there is a new gauze and a new stabilizer. We have a inner cannula, and then we also have a bottle of sterile normal saline. Okay? And at the bedside, and we have some emergency equipment. I just want to make sure it's working, and we have all of it. We have an ambu bag. It's attached to oxygen. We have a spare inner cannula. We have 2 trach kits, one of your size right now and one size smaller. I can hear that the oxygen is flowing, and I can also see and hear that the suction is flowing. It's set at 120 millimeters mercury rate. Okay, so I'm just going to wipe down the table quickly. Do you have any questions before we begin? Putting on gloves and wiping it down. Okay, we're going to let this dry for 2 minutes and repeat. And let that dry for 2 minutes, discarding my gloves. I'm going to begin replacing our items. Just setting this to the side for right now so it's easier to work with later. Okay, so got our items. I'm going to close the door, provide some patient privacy. I already just explained what's going to happen. We're going to sit you up in high fowlers, and then I will drape you. I already have my PPE on. Okay, I'm going to perform hand hygiene and turn on the oxygen to 15 liters or 100%, hand hygiene, and then I will open up my catheter kit. Okay, remove the sterile basin, only touching the very bottom tip, nowhere near the inside. Okay. Then I'm going to use the no-touch technique to pour in the sterile saline. Place that to the side, and then remove the paper envelope that the catheter comes in. I'm still not reaching over anything that's sterile, and I'm going to carefully attach the suction to the catheter, with just the tip out still. And then I will place it against the wall in a safe spot. The suction's already going at 120. Okay. So I'm ready to take off my gloves and perform hand hygiene once more. And then put on my sterile gloves. Okay, so I'm now sterile. Let's see. So I'm going to, with my non-dominant hand, remove the oxygen source. And then I'm being careful not to reach over the sterile basin and hyperoxygenate my patient 3 to 4 breaths with 6 seconds in between. Okay, still not reaching over anything. Okay, so with my clean hand, I'm going to now take just the tip of the suction catheter against the wall, and we're going to shimmy it loose. Okay, and with my sterile hand, I will grab the sterile portion, and I'm just going to make sure that's working by suctioning some sterile water, or saline, I mean. Okay, so it's working how I'd like, so I'm going to insert it into the patient until I feel resistance or there's coughing. Okay, there's resistance, and I'm going to occlude it and twist as I pull out. Suctioning. Okay, and we're going to do that for no longer than 10 seconds. If I needed to suction her again, I would wait at least 30 seconds, and I would also assess her oxygen saturation to see if she needed any more hyperoxygenation through the ambu bag. But it sounds like she's okay on the suctioning and her O2 is fine, so I'm just going to discard this in a proper place and replace her oxygen. Okay, place this in the trash. I can move this out of the way now. And I'm going to perform hand hygiene once more. Alright, Miss Elephant, you still doing okay over there? That was the hard part. Alrighty, so I'm going to carefully open up my trach kit, and still using no touch technique, I'm going to drop in the inner cannula. Okay, I can discard this and hand hygiene once more, and then I will remove the sterile gloves. Okay. Okay, so I'm now sterile, and with my non-dominant hand, I'll remove the oxygen mask. Okay, and then I will stabilize the faceplate and remove the inner cannula, drop that in the trash, and stabilize the faceplate that's still, and remove the old gauze. Dispose of that. Okay, and now I'm going to touch only the tip of the sterile inner cannula, the new one, and replace that until it clicks in place. Okay, and now I will replace the oxygen source once more. Okay, so now it's a clean procedure. I'm going to discard my gloves and perform hand hygiene just a little bit. Okay, so now we're going to carry on with the peristomal site care. With my clean hands and gloves, I'm going to discard anything that I won't need for this part. Just going to move these to the side. And then pour in sterile saline into the basin. Okay. So now I'm going to remove the oxygen mask. At this point, point before I clean the area or put a new gauze on, I'm going to do a site assessment. So I'm going to make sure that the faceplate is midline. Assess the skin around the insertion site. I don't see any redness or swelling, rash or skin breakdown. Okay. Alrighty. So now I'm going to, with my clean gloves, dip the cotton swabs in the sterile saline and clean underneath the faceplate from the inside out. I'm going to discard because I only swabbed one time, and then repeat inside out, discard, inside out, only swabbing once per Q-tip, and okay, so that looks okay. And I'm going to dip my gauze in saline and clean the area underneath the faceplate, the skin, wiping off any secretions, and the same with the top of the faceplate. Okay, and now I'm going to dry underneath the faceplate and the top of the faceplate. Okay, can discard that, and then I'm going to replace the gauze. You still doing okay, Miss Elephant? Okay, good to hear. I can actually use a Q-tip to shimmy it in there. We just want to make sure that it's lined up and that there's no bumps or creases that can cause skin irritation. Okay, so it looks okay. I'm going to replace my oxygen mask once more. Discard that, take off my gloves and perform hand hygiene. And then last but not least, we're going to replace your stabilizer. So I'm going to call in a second nurse. We're both doing hand hygiene and putting on new gloves. I'm going to replace or take off the oxygen once more. Oops, that's fine for now. Yeah. And then she's going to stabilize the faceplate while I take off one side at a time of the collar. And while I'm doing this, I'm going to assess the skin around the collar to check for any signs of skin breakdown or irritation. We're also going to not tie it too tight so that 2 fingers can comfortably fit in the collar. Okay, so I didn't see any signs of skin breakdown. 2 fingers fit in there. Alright, I'm going to replace the collar, or the face mask, the oxygen source. There we go. I can discard this. Alright, are you comfortable, Miss Elephant? Does it feel alright? Are you in any pain at all? No? Okay. Do you have any questions or concerns about the procedure? No? Okay, good to hear. I'm going to redo that baseline assessment I did earlier. I'm going to redo your vitals, your O2, your heart rate, respiratory effort, and then I've listened to your lung sounds once more. Okay, I'm going to then begin to clean up. There we go. Place this in the trash. I'm going to leave the emergency equipment at the bedside, so we still need all of that, the ambu bag, the oxygen and the suction going, the 2 trach kits, a new inner cannula. Okay. Alright, the patient is in a comfortable position. The collet is right here if you need anything. Don't hesitate to press it. Alright, I'm going to discard my gloves, do hand hygiene, and document the date and time of the procedure, the color, consistency, and amount of sputum, the peristomal site assessment, the vital signs and respiratory rate, and then the patient's tolerance of the procedure. Okay? Remember to use your collar if you need it, and then do hand hygiene and leave the patient.